One is it's exciting news. And you say, well, it's taken a while to get this news. Again, it reflects the safety programs the FDA have in place and the manufacturers are going through to ensure that vaccine is safe for everyone that we give it to. So, and it's exciting because that's a whole segment of the population, those down to the age of 16 that have not been a candidate for vaccine. And so to get to that herd immunity number, it's a whole group we haven't been able to immunize to try to get there. And so we're excited about that. So a couple of things about children getting vaccinated. We're learning more and more about how this virus works in children and in those under the age of 16. And what we've seen recently is more and more of those individuals becoming ill, and sometimes seriously ill, and sometimes occasionally you have people in that age group who die. So a couple of reasons we would consider vaccinating children. One is you protect that individual child. Two is you prevent spread of COVID within the community, which protects all of us. Keeps the hospital numbers down, it protects grandparents and parents and other loved ones, and it allows us to get back to doing activities that we've been wanting to do. We vaccinate children for a whole host of infectious diseases, and we've done so for many decades with great success. And I think, unfortunately, the modern society forgets a little bit about these infectious organisms and what they've done to societies over the years. And many of us, and I'm older than you might think, I don't remember some of the devastation of polio and measles and mumps and those things. And so we continue to immunize children because while the risk of those is rare, we have to protect the entire society, and those things can be deadly. And the vaccines are incredibly safe. So there are both personal reasons and public health reasons to continue to vaccinate people, even if most of us don't remember people dying of those diseases. And if we let our guard down, those diseases reemerge and we have tragedies. About dose, I believe it will be the same dose we're giving adults for this age group, and then it may change for younger than 12 eventually, but I don't know the details of that yet. And I think we will see people in that age group be willing to be vaccinated. I think a lot of families are used to have their kids getting vaccine. They want them to get back to doing the things they want to do. My guess is there'll be a pretty direct correlation as to whether parents got vaccinated as to whether their children got vaccinated. Parents who have not been vaccinated may be less likely to vaccinate their children. I think going over time, you may see that school systems and other entities say, hey, we require vaccination as we require vaccination for other things for kids to go to school. This might end up on the list eventually, although I have not heard that, but I think over time you can see that. What we realize is that younger people have vigorous immune systems and they respond well to vaccination, more so than folks that say over the age of 65. What's remarkable about these vaccines is how they work so well across age groups, but adolescents will respond very vigorously to vaccines, and that's really exciting. Because it means they're going to be protected quickly, and hopefully for longer periods of time than older folks. All the more reason that people in that age group ought to be vaccinated to protect other parts of our community,